Welcome everybody to our very first Advocacy Institute for the year 2025. Also, the very first Advocacy Institute for MDA's 75th year. You can see kind of in the corners of our screens for a handful of us that we are celebrating our 75th anniversary this year as an organization. And trust me, you'll be hearing a whole lot about that as the year continues. But let's talk about the year ahead more specifically for public policy and advocacy. So for those of you who might not know me, I am Paul Melmeyer. I'm the Executive Vice President of Public Policy and Advocacy within the Muscular Dystrophy Association, and I'm going to be your host for the evening. And this is what our next hour or so will look like. We're going to introduce you to the Public Policy and Advocacy team. I would expect some of you know most of us, maybe even all of us, if you've been with us for a little while. But some of you might not really know any of us. So we want to be sure that you know who at MDA is tackling these public policy issues, who's working with you to advocate for these issues. And you're going to get a chance to meet all six of us on the public policy and advocacy team here just in a moment. From there, we're going to move outside the MDA team. We're going to introduce you to the new Congress as well as the new administration, because obviously both Congress and the administration will be playing pivotal roles in the public policy that will or will not be moving forward in the next 12 months that might be salient for those in the neuromuscular disease community. We'll talk about the key priority issues that we're going to be focusing on over the next year or so, and then also some key dates, some key events, some key activities that you can expect from us within 2025. And then, as always, we'll be happy to take any questions that you might have about what we covered or perhaps what we didn't cover. So to move to the next slide, the way in which you can ask those questions is to go to the Q&A box. You go to the very bottom right of your screen. You see those three little dots down there, and if you click on those three little dots, you find Q&A, and then you can pose a question to the advocacy team here via the Q&A box. There's also the chat box there, and it's a great way to interact also with other participants within the webinar. But if you want to submit a question, we do encourage you to use the Q&A box in particular. And for those of you who might want to utilize the closed captioning, you go to the very bottom left of your screen. That's where you find the closed captioning option. We are recording this, so in case you're wanting to get as much information as you possibly can, don't worry if you want to catch up on it on YouTube. Sometime whenever we get it up on YouTube in the near future, you can do so. We do post those there in case you also need to dash to something else, perhaps as well. If you can't join us for the full hour, don't worry. You can always catch up on YouTube when we post it to MDA's channel there. Okay, I think that's all the housekeeping. So let's introduce you to the advocacy team. I mentioned my name and title already, but let me just give you another minute or so on me. I've been with the Muscular Dystrophy Association since June of 2019, so I'm actually going to celebrate 6 years at MDA coming up in June. And I've been advocating for those with rare diseases for over a decade now. Prior to MDA, I was at the National Organization for Rare Disorders for a little over 6 years. So I've spent a good amount of time in the public policy and advocacy field advocating for those with rare diseases. But in addition to that, I also have a degree in public policy from George Washington University, and I still call Pittsburgh my hometown, and will always be out there rooting for my Pittsburgh sports when I have the opportunity to do so, even though I am here in Silver Spring, Maryland, just outside of DC at this point. But that's me. I think I would like to maybe go around the circle here and introduce the other MDA advocacy team members present for the evening. Joel Cartner, I'm going to call on you next.
Hey everybody, my name is Joel Kartner. I'm the Director of Access Policy here at MDA. I joined MDA in March of 2022, so I'm very nearly on my third year anniversary. Prior to MDA, I was a practicing attorney. I worked in a wide variety of spaces. I worked at a protection advocacy firm for those with disabilities for a little while. I was a lawyer for a hospital system for a while, and did some practice in, for want of a better word, pharmaceutical development and complex litigation for a little while. I'm originally from North Carolina. I went and got my BA in political science at UNC Wilmington, and then got my law degree at Quinnipiac University up in Connecticut. So that is me.
Awesome. Thanks, Joel. Shannon, I'm going to turn to you next.
Hi, everyone. I'm Shannon Wood. I am Director of Disability Policy here at MDA. I joined the association back in April of last year, so coming up on my 1 year anniversary. Prior to joining MDA, I served as Director of Advocacy and Policy at the National Multiple Sclerosis Society. So there I worked on disability and health policy issues. Prior to that, I worked in state and federal government relations for the American Psychological Association. Excited to be here.
Thanks, Shannon. All right, Sean, I'm turning to you next.
Good evening, everyone. I'm Sean Hill. I am the Manager of Public Policy and Advocacy here at MDA. I came shortly after Joel in August of 2022. I have served a multitude of roles, both in patient-based as well as provider-based organizations. Although I live right outside of DC in Silver Spring as well, I consider myself a native Washingtonian. And if you really want to get me geared up, talk about those Commanders.
Absolutely. Thanks, Sean. Your football team got further than any of the rest of ours this year. So congratulations on making it to the championship. That was exciting. All right, Mark, I'm handing it to you next.
Hey everybody, this is Mark Fisher, Director of Advocacy Engagement. Nice to see so many familiar faces, but some new faces here, so happy to be here. I started MDA in December of 2019, so shortly after Paul, so a little over 5 years here. Before that, I was at the American Heart Association as well, doing lots of advocacy work with them, and I was there for around 8 to 9 years before I hopped over here. So I'm super happy to be here. Like Paul, I'm originally from Pittsburgh, Pennsylvania. I bleed black and gold, and that can be really annoying for folks, but that's who I am. So just happy to be here, and I'll turn it back to you, Paul.
Thanks, Mark. All right, Jory, let me turn to you next.
Hey everybody, my name is Jory Hauk. I am the Manager of Advocacy Engagement here at MDA. I have been on the team since September of 2023, so time has flown very, very quickly, and it's been a really great experience so far, and very grateful for the opportunity to get to know so many of you on the call tonight as well. So prior to that, I was handling media relations and grassroots advocacy for the Association for Career and Technical Education, which is an organization that focuses on promoting career and technical education and workforce development at both the federal and state level. Immediately prior to that, I was doing a couple of fellowships on Capitol Hill, so spent a little bit of time on Capitol Hill as well, seeing the things from the inside out, if you will. And then right before that, I was actually in college. I am a proud graduate of the University of Connecticut. I'm a very, very passionate UConn Husky sports fan, as anyone who knows me will say, and I'm a huge outdoors person, huge dog person as well. So those are just a couple of my hobbies outside of the office. So very happy to be here, and I will turn it back over to Paul.
Thanks, Joy. And you're going to be hearing from pretty much all of us this evening as we go through the remainder of the program talking about the year ahead. But if you email us at advocacy@mdausa.org, that's the advocacy inbox, and you're going to reach basically all 6 of us in doing so. And we are the public policy and advocacy team that will be responsive and are tackling everything that we will now talk about for the rest of our hour together. Okay, so let's move forward. Now that you've had a chance to meet the team, let's talk about the 2024 year in review. Because as we talk about 2025, it's good just to kind of look back at what we were able to achieve together last year. And it was thankfully a whole lot that we were able to do together. So for one, it was a monumental year in improving air travel. We were able to pass the FAA reauthorization in May of last year. A lot of our advocates were involved in contacting their congresspersons, getting this bill across the finish line, signed into law. And included within that legislation were a number of different provisions to make air travel more safe and accessible for those with disabilities. Nearly at the same time, the Department of Transportation was working on a wheelchair user rule that also seeks to make air travel safer and more dignified for those with disabilities, particularly those who use wheelchairs. And actually, it was that rule that was finalized in December and is already taking effect now in the beginning of the year in a number of different ways. We made progress in newborn screening. As of last year, all 50 states are screening for spinal muscular atrophy. There was progress in Pompe disease as well as for the very first time, we had states screening for Duchenne muscular dystrophy, and we're actually up to 2 states who are actively screening for Duchenne, with an additional 2 planning to start very shortly, and perhaps more from there. And we'll get back to that in a minute. We saw further implementation of the Act for ALS, legislation that especially the ALS community, but really everybody with a rare neurodegenerative disease, is benefiting from in a number of ways. Telehealth flexibilities were extended at the end of the year until March of this year. We'll come back to that in a moment as well. And then we also, of course, launched and ran a campaign on accessing the vote, making sure those with disabilities knew their rights, leading to the voting booth, if you will, in November, as well as knew the issues that would be salient potentially to their vote. I'm going to turn it over to Joel Gardner, who's going to just say a word on Section 504.
So Section 504 of the Rehabilitation Act of 1973, for those of you that don't know, is kind of the grandfather of disability rights law. It covers non-discrimination for those with a disability across any federally funded program or space. So it's a very wide area. Recently, or last year, HHS, the Department of Health and Human Services, updated the rule for the first time in about 50 years. It encompassed things like access to diagnostic medical equipment, ensuring access to care and therapeutics, really just a wide variety of updates to the law since it hadn't been updated in 50 years. And we're very, very proud of the vast variety of updates that we were managed to secure during that comment process.
Awesome. Thanks, Joel. So as you can see, 2024 was a big year for our public policy and advocacy, including, of course, for everybody on staff and within the organization, but because of all of you as well for joining us and raising your voice and making sure these huge steps forwards, whether it's in access to care and developing therapies or in living with a disability, that all of these steps forward were achieved in 2024. So let's stop our look backwards and let's start our look forwards into 2025. And let's start with our next slide, which is on our new Congress, the 119th Congress. So with that, I'm going to hand it to Mark Fisher.
Yeah, so let's meet the 109. Let's go through it. So in the House, we have a much tighter margin in the House than we had during the last Congress. So right now there's 218 Republicans, there's 215 Democrats, and there's 2 vacancies right now. That 218 number for the Republicans is probably going to drop again to around 217 as members of the House are joining the Trump administration's cabinet. So those seats will be refilled and there will be special elections, but that'll take some time. So we have a very, very narrow majority of Republicans in the House. It's very, very tight. So the Republicans can't afford to lose many votes if they want to pass something just with their party. That probably results in a lot of bipartisan legislation coming through because the margins are so tight. So, but we do have a Republican House. In the Senate, we also have a Republican Senate. There's 53 Republicans. This is a switch. Last time the Democrats had the House. So this last time the Democrats had the Senate, excuse me. Now the Republicans have the Senate, and they have a 53 seat majority there. There are 45 Dems and 2 independents, but those 2 independents caucus with the Democrats. So if you see 53 Republicans and 47 Democrats, that is why. So like in the House, the Senate is controlled by the Republicans. So they control both chambers of Congress by narrow margins. The freshman class, we have lots of new freshmen who came in. We have 75 new members to Congress. That's quite a bit. So a lot of new relationships to build, a lot of new lawmakers to learn about and see what their likes and what their passions are. We have 12 new senators, which is quite a bit. So 12 new senators came in this year and 63 new House members came in here this year. So just to recap, Republican controlled of both chambers, but by pretty narrow margins. And with that, I'll turn it back to Paul.
Thanks, Mark. So as we're looking at Congress and furthering our relationships with those who are particularly influential on Capitol Hill, it is these individuals who we're kind of turning to first, because of course in the U.S. House of Representatives as well as the U.S. Senate, there's going to be a majority leader or a speaker, and of course these are 2 Republicans, and then 2 minority leaders, the lead Democrats on the House side and the Senate side. Over in the U.S. House, the speaker remains the same. It's Representative Mike Johnson of Louisiana, and the minority leader also remains the same. That's Representative Hakeem Jeffries of New York. Over in the Senate, we actually have a new leader, and this is Senator John Thune of South Dakota. It had previously been Senator Mitch McConnell of Kentucky, but he decided not to run for majority leader again this Congress. Instead, he's still a senator, but stepping down from his leadership position. Instead, John Thune of South Dakota has taken that position. On the minority side of things, Chuck Schumer remains the lead Democrat in the Senate. Now, we also, aside from the leadership of the parties in the House and the Senate, we also look at the leadership of the key committees of jurisdiction, those committees that are most relevant to the public policy that is impactful to those with neuromuscular diseases. And we're going to call out these four. And it's not that there are only four committees on Capitol Hill that are important, but these are the four that do have the greatest oversight of the policy areas that we know can really make a difference in the lives of those with neuromuscular conditions. On the House side, we have some new leadership on the Energy and Commerce Committee. And for those of you who might not be familiar with how the House works, you might be thinking energy and commerce, why is that exactly important to those with neuromuscular diseases? Well, energy and commerce, strangely enough, with the name at the very least, has essentially the entire healthcare jurisdiction in the House of Representatives. And so it's a very important committee for that reason. Representative Brett Guthrie of Kentucky is the new chairman of the Energy and Commerce Committee. He replaces Representative Kathy McMorris Rogers, who retired. And then the ranking member, the Democrat Frank Pallone of New Jersey, remains the same. Now, Representative Brett Guthrie of Kentucky, we have a very good relationship with. He previously had been the chairman of the Health Subcommittee on Energy and Commerce. Now he's chairman of the full committee, and we collaborated with him in many ways as he was chair of the subcommittee on health. So we have a very strong relationship with Mr. Guthrie, and we'll continue that relationship. Over on the Ways and Means Committee, we have the same two leaders as we had last Congress. That's Representative Jason Smith. He's the chairman, and he's a representative from Missouri. And then ranking member Richie Neal of Massachusetts, the lead Democrat on the committee. Moving over to the Senate, of course, the balance of power flipped from last Congress. Whereas Democrats controlled Senate last Congress, now Republicans control the Senate in this Congress. And so we have a new chairman of the Health, Education, Labor, and Pensions Committee, and that's Dr. Bill Cassidy of Louisiana. Now, Dr. Cassidy was the ranking member in the last Congress, and we collaborated with him on many issues at that time. And then the current ranking member, Senator Bernie Sanders of Vermont, had been the chairman. Now he's, of course, the ranking member. So they just flipped spots. But we work with both of them closely last Congress on a number of issues. Now, moving over to the Finance Committee, and this is the committee that has jurisdiction essentially of, in many ways, how the government takes in money, and in many ways, how the government then spends that money. We again have a flip of the seats given the change in power. Senator Mike Crapo of Idaho is now the chairperson of the Finance Committee, and Ron Wyden, who had previously been the chairman, is now the ranking member of this Senate committee. He's a Democrat from Oregon. So as you can see, we have some new members in some new important places, or some new leaders, I should say, in some new important places. Almost everybody here has been in Congress for much longer than just a handful of years. But in their new leadership positions, we've already started to rebuild these relationships in their new capacity. And thankfully, we've had a very good relationship with essentially everyone here over the years, collaborating with them to serve those with neuromuscular diseases. So let's move to the next slide. And this is where we're going to start talking about the administration. And we already have some new cabinet members. And Shannon Wood, I'm going to hand it over to you.
Thanks, Paul. So those of you who have been tuning into the news, you might know that a lot of Capitol Hill right now is focused on nominations and confirming a lot of these new agency leadership heads. The two that you see pictured here are folks who have already gone through the confirmation process and are in their posts. So we have Sean Duffy. He is the new Secretary of Transportation. He is a former member of Congress. We also have Pam Bondi. She is the new Attorney General. She was the former Attorney General in Florida. And then we also are still continuing to watch the hearings of some of the other nominees that have been put forward. Linda McMahon has been put forward as the nominee for the new Secretary of Education. She was the former Small Business Administration administrator. We have RFK Jr., who many of you know from the 2024 presidential election. He's been nominated for Secretary of HHS. Dr. Oz has been tapped to lead CMS. Jay Bhattacharya has been tapped to be the NIH director. He is a professor at Stanford, came to prominence during the COVID-19 pandemic. We have Dave Weldon, who's been tapped to lead the CDC, and then Marty Macri to lead the FDA.
Awesome. Thank you, Shannon. So moving on from the new cabinet members, let's now start talking about the issues. We've talked about the people in these leadership positions, whether it be in the administration or whether it be on Capitol Hill. Now let's start talking about the issues themselves. And to move to the next slide, let's just even take a step back beyond talking specifically about 2025 and talk more broadly about, in general, what we focus on within our public policy and advocacy. And much of what we do within our department, of course, comes from what you ask us to do, what the neuromuscular disease community tells us is a priority when it comes to public policy and advocacy. And nearly everything fits within three categories. The first category is access to care. And this is where we try to increase access to all of the different services, whether it be a faster diagnosis or medical devices or therapeutics or telehealth or quality insurance, all the ways in which an individual with a neuromuscular disease can be served by our healthcare industry. We're trying to ensure greater access to those things that can benefit our community's health. So I mentioned that's shortening the diagnostic odyssey. That's access to specialists and home and community-based services. That's access to genetic medicine, including newly approved gene therapies over the last handful of years. So it's within our access to care area, we try to ensure that access for our community. Within our accelerating therapeutic development area, we try to accelerate the development of more and better therapies for our community. And in particular here, we're also looking at gene therapies for those genetic diseases that are within the neuromuscular disease community. Given that every single neuromuscular disease is a rare disease, we are also paying very close attention to rare and ultra-rare drug development, trying to ensure that ecosystem is strong. And of course, before drugs are even developed, ensuring that our basic and translational research pipeline is well funded and is operating as it should to make sure that these scientific breakthroughs can eventually reach our community. And in doing so, we're trying to integrate the patient voice throughout. Finally, within our third area of empowerment and independence, this is where we try to knock down all of those societal barriers that still remain in front of those with disabilities trying to live the life that they want to lead. And that can include barriers to accessible transportation, whether that's air travel or any other kind of transportation for that matter. Barriers to finding employment or building a career, barriers to obtaining the education that one might want to obtain, barriers to being fully economically independent and being being economically secure. These are all ways in which within our empowerment and independence portfolio, we're trying to ensure through public policy, we're doing our very best to knock down these societal barriers in front of those with neuromuscular disabilities. So that's the big picture of our public policy and advocacy efforts. Let's move to the next slide and let's start talking about 2025 in particular. So I don't think it's lost on anyone here on this call that we've had a change in administration over the last couple of weeks. And frankly, it's only been, I think, a little over 2 weeks. It's been 15 days, I believe, since the new administration was inaugurated. And with the new administration comes a number of new approaches. We've seen a number of executive orders and other administrative actions that this administration has taken that we do believe very well could be affecting those within our community. These could be actions pertaining to communicating and collaborating with partners at federal health agencies, activities associated with accessibility for those with disabilities, as well as employment opportunities for those with disabilities. We're seeing funding for critical federal programs being reapproached, as well as other things that it's been 2 weeks. There will be much more from here that the administration is going to be likely tackling over the course of the remainder of their term. So with this change in administration means we have all of these new situations to navigate. And first and foremost, where we will be navigating these situations will be with our coalition partners, whether that be coalition of the neuromuscular advocacy groups that we convene, the Neuromuscular Advocacy Collaborative. That might also be coalitions of disability advocacy organizations, such as the Consortium of Constituents with Disabilities, or coalitions of those who care about certain agencies, such as at the NIH or at the FDA. Point is that we're going to be mostly working within our coalitions to ensure the neuromuscular disease voice is heard within the deliberations of this administration. And where we don't have an opportunity to work with a coalition partner, we'll be still ensuring that our principles and our commitment to those with neuromuscular diseases is made very clear, not only, of course, to our community, but to the administration, to decision makers elsewhere within our government, really to the stakeholder community at large. So we'll be hitting some of these things we're anticipating is coming our way from the administration as we go along within the policy issues coming up. But of course, with day 15 of this new administration, we're navigating the changes that this new administration is pursuing along with everybody else. So let's move to the next slide, and let's talk about Congress. Let's switch from the administration to mostly talking about Congress. And actually, the first thing we have to do is tackling some leftover things from last year. And Joel Gardner, I'm going to hand it to you.
Yep, thanks, Paul. So there are a number of unfinished things from last year's Congress that we got very, very close to getting over the line. In the initial drafts of the package, they were all there, but unfortunately that package just fell apart there at the end of the year. So what are those things? Accelerating Kids Access to Care Act was streamlining the process for children who use Medicaid across state lines to receive that care. Extending telehealth flexibilities. The use of telehealth was expanded during the COVID-19 pandemic to allow for more people to use it in more and broader circumstances. Those need to be reauthorized by March 31st. So we'll be sure to get those re-upped once again. And then pharmacy benefit manager reforms. PBMs are kind of the middleman between your pharmacy and your insurer. And PBM reform was a way to essentially drive down costs of therapies for patients. So we were really, really eager to see that get done as well, and we will be working very hard to get those things across the line. I'm going to pass it back over to Paul to discuss the PRV voucher.
Yeah, thanks, Joel. An additional item that we weren't able to quite get across the finish line was the reauthorization of the Rare Pediatric Disease Priority Review Voucher Program at the Food and Drug Administration. This program unfortunately expired at the end of December because it was not reauthorized. But we are hopeful that with this 2024 unfinished business, thankfully, each of these bills essentially had been negotiated by Republicans and Democrats up in Capitol Hill, and they were ready to pass each of these 4 bills or these 4 provisions, but unfortunately at the very end of the year we're unable to do so. So we're hopeful that they'll bring back the full package that includes these 4 provisions and try to pass it again here in the next month or two. We're hopeful maybe sometime in March they might take another crack at getting these 4 pieces of legislation finally passed into law and these programs up and running. So let's move to the next slide. And with that, I think I'm going to hand it back to Joel.
Yep, thanks, Paul. So in access to care, there are a number of things that are going to happen over the first 6 months. The first of which is going to be focusing on reintroduction of key bills that didn't get over the line from last year, in addition to the priorities we already discussed. So Access to Genetic Counselor Services Act was a bill which allowed for the coverage of genetic counselor services under Medicare. That's super important for people as they attempt to find a diagnosis. Genetic counselors are really key in that process. And so covering their services makes it much more likely that people will have access to those services. So we really want to see that one across the line this Congress. The MVP Act is a little bit complicated, but basically it codifies regulations around what are called value-based purchasing agreements, which essentially is a way to help insurers be more comfortable paying for these very expensive gene therapies. As we know, it can be a little bit of a guessing game as to whether or not a therapy was going to be successful in what it tries to do, and they're very expensive. So giving insurers some leeway in terms of how they pay for those things was really important for us. After we get those bills reintroduced, we're also going to be navigating through the reconciliation process. Reconciliation is a budgetary process which allows for the passage of budget-based legislation to pass through Congress on a simple majority rather than through the 60-vote threshold that is necessary over on the Senate side. In that process, there may be things that are on the table for cuts to pay for various other programming that the majority wants to get across the line this Congress. And potentially on the chopping block are Medicaid, ACA tax credits, and protections for pre-existing conditions. We're going to work very hard to make sure that none of those things are used in this reconciliation process. And just to circle back on those tax credits for a second, they are tax credits which help pay for ACA insurance plans when you make too much money to be on Medicaid, but not quite enough money to be able to afford an ACA plan whole cloth. Those tax credits step in to help bridge that gap. They expire in September of this year. But we're going to work really hard to make sure that those get reauthorized as well. We'll be protecting provisions in the Inflation Reduction Act, which were vital in reducing cost for medications under Medicare Part D, primarily through things like the negotiation process that's been rolling out over the last couple of years and things like that. And then finally, we'll be keeping an eye on regulations in Medicare Part D, patient access in general around Section 1557, which is non-discrimination under the ACA. And then, of course, you can take the man out of the legal profession, but you can't take the lawyer out of the man. So we will be paying attention to the various legal goings on to make sure that your rights and access are protected in the courts as well.
All right, thanks so much, Joel. So let's move to the next slide, and we're going to talk just a minute on newborn screening because we're expecting 2025 to be a big year in newborn screening as well. So within the first 6 months, we're hopeful that there will be a really important vote from the Federal Advisory Committee on Heritable Disorders in Newborns and Children, or the ACHDNC, to recommend Duchenne muscular dystrophy to be added to all newborn screening panels across all 50 states. We've been working in coordination with our collaborator, Parent Project Muscular Dystrophy, PPMD, on this for several years. PPMD has been taking the lead, and we've been helping along the way. And we're hopeful that in the May meeting of the ACHDNC, they will vote to move forward with Duchenne. We don't know certainly that there will be a vote or that will be a positive vote for that matter, but we're expecting May to be an important month nonetheless. Now, while that's happening, we're also working to add Duchenne to additional state panels. As I mentioned earlier, it's already technically on 4 state panels, them being Minnesota, Ohio, New York, and Massachusetts, I believe. Now, only Ohio and Massachusetts are actually screening at this moment, as far as we're aware, but Minnesota and New York shouldn't be too far behind. Now, we're hopeful, though, within 2025, especially within the first half of the year, because that's traditionally when state legislatures are meeting, that they will also be adding Duchenne to their state panels. And we're collaborating with our colleagues in other Duchenne advocacy organizations and biotechs to see if we can make that happen. Now, zooming out from Duchenne again, we're still expecting further implementation of Pompe disease to be screened for in the states. If you can squint at the map on the right side of your screen there, you can see there's different colored states. Those states that are in white, we'll call it white, are screening for spinal muscular atrophy, but are not yet screening for Pompe disease. So they're examples of states in which we're hopeful Pompe will catch up to where SMA is, and maybe we'll get all 50 states screening for Pompe here in the not too distant future. Now, zooming even further back out of specific disease areas, we're also expecting a very important National Academies report to be published in the spring on newborn screening. And with that report in hand, we'll be going to Congress to reintroduce the Newborn Screening Saves Lives Reauthorization Act, really important and seminal legislation to support the newborn screening infrastructure across the country. And that will be more so later on within the year, but things happening in the first half nonetheless. Let's move to the next slide. And this is where we're going to transition over to therapeutic development. Because within therapeutic development, we're anticipating a handful of things to be happening within the first half of 2025. For one, Joel already mentioned the reconciliation effort that House and Senate Republicans are already undertaking at this moment and will be seeking to pursue over the course of the next couple of months. There are also implications for the Inflation Reduction Act, as there are certain Republicans who want to add reforms to the Inflation Reduction Act to this reconciliation effort. These include efforts pertaining to the intersection of the Orphan Drug Act and Medicare negotiation, as well as some technical corrections that we've actually been supporting to make, because the Inflation Reduction Act, while it's done a lot of good, it also was not perfect, and there are some things that do deserve to be revised. Now, while all of this is going on in the first half of the year, we're also expecting Congress to tackle appropriations across the board, but here within therapeutic development, that's where we look at appropriations for the Food and Drug Administration, for the NIH, for the CDC, for the Act for ALS programs, for newborn screening programs, really anything in which the federal government funds. Congress is to appropriate it, and they will be doing a lot of that negotiation, a lot of that work here within the first 6 months. Moving on from there into additional things we'll be keeping an eye on in the first 6 months would be monitoring potential FDA and NIH reform efforts. And as I mentioned earlier, as I was talking about efforts that the new administration might be undertaking, that includes efforts to potentially reform things in the Food and Drug Administration and the National Institutes of Health. We've seen proposals, actually more so from up in Congress, but still we've seen proposals that would actually consolidate different NIH institutes, combining institutes into one or into fewer perhaps than we have right now. With the new administration and new Congress, ARPA-H, which was created under the Biden administration, might also face a new direction. And then there might also be reforms on how the NIH focuses its funding. For example, Senator Bill Cassidy, I mentioned him earlier, he's the chairman of the Health, Education, Labor, and Pensions Committee, has advocated for NIH to refocus its funding more on basic science and less so on some of the other funding that NIH has proposed. So while that might be happening at the NIH, there could also be things happening at the FDA. We expect the accelerated approval pathway to remain in the conversation within the new FDA. And there might even, with a new commissioner or new leadership within the FDA, be changes to policy there, as well as a number of other things we can't necessarily anticipate in this very moment. But nonetheless, within these first 6 months, we expect FDA and NIH to remain in the conversation of ways in which these agencies can be reformed. Let's move to the next slide. And with that, I think I'm going to hand it over to Shannon.
Thanks, Paul. So looking at the first 6 months of 2025 as it relates to our empowerment and independence policy bucket, also our disability policy bucket, we know, as we've covered on this call, we have a lot of new members in Congress, and with that comes a lot of opportunities for member education. So both about disability policy, our priorities related to it, but also about what neuromuscular disease is and how MDA serves our community. In addition to that, we know with the election results in 2024, we did lose some of our really big champions. So Senator Bob Casey of Pennsylvania, he was our lead Senate champion on a ton of different disability policy issues. Those of you who are with us as we advocated for SSI reform, especially that SSI Savings Penalty Elimination Act, many of you may know that Senator Brown lost his re-election bid. So we are currently and will be throughout the first half of this year securing new champions for our issues and identifying some of those champions and those new members that are just now coming in. And through that, we'll be amplifying the voices of people living with neuromuscular disease with that lived experience in policy discussions, both reconciliation that Joel and Paul both mentioned, and then also tax package negotiations, which we know are going to be a huge focus on Capitol Hill this year. We will be getting to some of that bipartisan work, some of that nitty-gritty policy making, but that's likely to come later in the year. Next slide. So I wanted to touch on some of the issue areas that we're going to be working on within disability policy, where we're expecting to see some movement. And these are pretty broad buckets. The first being Medicaid protection for all of the reasons Joel outlined. We know that there are serious threats to Medicaid, and we know it's incredibly important for people with disabilities in terms of their access to care, access to services, and full participation in the community. So in addition to Joel's angle and that health access angle, we'll also be working Medicaid protection as it relates to people with disabilities. So looking at it as the primary payer of home and community-based services in this country, the impact of proposals like work requirements, what that means for people with disabilities, also any impact to employment supports that people currently get through Medicaid. So that's going to be a huge issue that we'll be working on this year. Also staying committed to protecting civil rights that are existing in law. This is across a number of different laws, including the ADA, Section 504, Section 5057, the IDEA, the Office of Civil Rights, protecting the civil rights that we have in law from any sort of threats to them. We'll also be continuing our work on federal benefit programs, both strengthening access and streamlining the process to get benefits to which you're entitled. This includes both SSI, supplemental security income, and then also Social Security disability insurance. This particular issue is going to come up a lot as we go through the reconciliation process. We know that due to how reconciliation is structured, SSDI and Social Security retirement payments are not going to be impacted, but SSI threats do exist. We'll be carefully monitoring that front, again, working both as an individual organization and in coalition with our partners. Other areas include just strengthening financial security for people affected by neuromuscular disease and those with disabilities. So that includes strengthening access to ABLE accounts with the Tax Cuts and Jobs Act of 2017. The way the law was set up was the entire individual side of that tax law expires at the end of this year. And within that, there's a few key provisions related to ABLE accounts. We already have legislation introduced by Senator Schmidt to kind of make those extensions permanent. So we'll be working around ABLE accounts. And then also, as Paul mentioned, we're going to be working on travel accessibility. We had some great wins last year, both in the 2024 FAA reauthorization bill, which is now the law, and then also that wheelchair user rule from the Department of Transportation. So we've got some implementation deadlines coming up. We'll be working with the administration and with our champions of both parties in Congress to make sure that that law is fully implemented as Congress designed. Also around travel accessibility, there is a lesser known reauthorization this year, and that's surface transportation reauthorization. This particularly applies to highways. Again, it's kind of in the name there, surface transportation. As it relates to disability policy, there's been some interest in addressing autonomous vehicles and impacts to the disability community within that. So we'll be carefully engaging within that reauthorization process too. And then another area that we know is incredibly important to our community is supporting caregivers, both through financial efforts, so ways to alleviate the economic burden of caregiving, but also to make sure that they have social supports, things like respite available to them. So there is a lot of bipartisan support and momentum for working on caregiver policy as part of President Trump's 100-day plan to get his agenda across. So we're hopeful that we can move forward some initiatives related to caregiving. And so that's the first half of 2025, which is jam-packed. Looking to the second half of 2025 as it relates to disability policy. Again, as I said earlier, that bipartisan work is going to be slow to start. Things like caregiver policy, things like SSI, Savings Penalty Elimination Act. That's going to be a little bit longer as Congress is kind of singularly focused on reconciliation and the budget work. We know that the tax package is going to be coming along. It's still unclear if it'll be one bill, two bills, what that's going to look like, but they have a lot of work to do as it relates to tax cuts and the tax package, so we'll be engaging there. As was alluded to previously, we have government funding going on, and that's for both FY25 and FY26. That'll be likely to leak into the second half of this year. And then with that, I'm going to turn it to Joel to talk about second half for access to care.
Yep. Thanks, Shannon. So we'll be tackling wheelchair repair. Senator Duckworth is working on a bill right now that should pick up some steam in the back half of the year. And then there are a couple of other bills that are floating around out there around wheelchair repair and access to things like wheelchairs in alternative alloys. The ALS Better Care Act will be coming back and probably picking up steam in the second half of the year. That's coverage of services for multidisciplinary services for those living with ALS. The Patient Access Act, which needs to find a new home most likely this year, but that was attempting to make it easier for people to afford travel to receive complex therapies such as gene therapies. Precision Medicine for Kids Today, which is that same kind of look at genetic diagnosis for children. It's kind of the companion to Genetic Counselor Services Act, which is for adults. And then gene therapy access generally, not just the Patient Access Act, but as we see more and more gene therapies being approved and in the pipeline, we really want to be working on the legislative and regulatory end to make sure that we have as much robust access to gene therapies as we possibly can.
All right, thank you very much, Joel. So to wrap up within our 3 policy areas, what we're going to be looking in the second half of 2025 for therapeutic development, we're actually expecting there to be a lot more activity in the second half than in the first half. And that's because there will be certain conversations around some key reauthorizations that are really going to be picking up at that point. For one, the Act for ALS is actually set for reauthorization in September of next year, September of 2026. But that means that the conversation, which actually has already started, will really be more concertedly starting in the second half of this year. We're expecting the Government Accountability Office, the GAO, to issue reports on how well the programs commissioned from this bill have been working, and then from there to set the stage for a 2026 reauthorization conversation. We're also expecting this summer for the FDA user fee reauthorization discussions to start. Now, those programs aren't due to be reauthorized until all the way in September 2027, so we're talking 2.5 years away essentially. But it actually is a 2-year process in which industry and the FDA get together to discuss how these programs should be reauthorized. And then just about everybody else who is within the stakeholder community comes together to talk about how we should reform programs at the Food and Drug Administration. It all gets collected into one big bill that then passes, hopefully, in September or earlier of 2027. 21st Century Cures 2.1 remains a point of conversation, especially on the House side. This is an initiative to accelerate the development and access to really innovative treatments, and Representative Diana DeGette of Colorado wants to lead this initiative once again. And then finally, also in 2025, you can expect the Muscular Dystrophy Coordinating Committee, the MDCC, to finalize their 10-year action plan. They've actually been working on this with us at MDA and others for over a year now, and we're excited to actually finalize this plan this year that really kind of charts the course for the next 10 years in muscular dystrophies. So with that, I'm going to ask for the next slide, and I'm going to hand it over to Mark Fisher. Mark.
Thanks, Paul. Appreciate it. I'm seeing some great questions in the chat, so we'll make sure that we have enough time to answer those. So how you can help. We've talked a lot about what we're going to be working on, but there's a lot of things that we can do to help push these initiatives over the finish line. So I know for many of you, you are tried and true veterans. You have been with us for a long time, so this is going to be very familiar, but I see some new folks on the call. So we wanted to talk a little bit about some of the opportunities you have. First thing we always ask you to do is sign up with us if you don't get our advocacy emails. You can do that at mda.org/advocacy, or you can text MDA USA to 50457. So that's the first step to do that. If you do that, you'll receive timely email updates from us letting you know what is going on in Congress or in the administration and how you can help. We'll show you how you can email or tweet your members of Congress to make sure your voice is heard. So having folks hear your voice is super important, and we make it easy for you on our website. So the first thing to do obviously is to sign up, and then we'll show you how you can make your voice heard through email actions. Also, we expect lots of opportunities at the government agencies. As Shannon mentioned, for instance, in the Department of Transportation is implementing a lot of our air travel work we did last couple of years. They're going to need input from the community on that. So that's just one of an example that we think folks can plug into this year. So you can help us with that. You're here, so you're on a webinar, but we'll have plenty more of these webinars throughout the year and other trainings. Last year, we debuted a new media training, which was very exciting. So we'll have plenty of educational and training opportunities for you throughout the year. But the most important thing is to share your story, whether that is emailing your member of Congress, or if you happen to meet with your member of Congress, or you can share your story with us on many issues on our website. That's pretty much the most powerful thing you can do, is share your lived experience, and it can make a big difference. You also can do some offline opportunities with us. You can visit your member of Congress's office, whether in DC or in the your local district. You can call your member of Congress still. You can pick up the phone. It still works very well. You can write blogs and other pieces. We can organize in the community. So there's a plethora of things that you can do. So whatever you're comfortable with, we have an opportunity for you to get involved. So again, you can sign up with us at mda.org/advocacy. You can email us at advocacy@mdausa.org and get in touch with us, and we'll find the right opportunity for you. We have a couple that we want to make sure folks are aware. So with that, we can go to the next slide, and my colleague Jory can take the floor.
Yeah, thanks, Mark. So 2 events that I want to call your attention to here in the next couple of months and weeks ahead. So the first one is Advocacy Office Hours. So this is a new thing that we've decided to do to provide another forum for all of our folks and grassroots advocates in our community to be able to ask us questions directly, share what's on their mind, share thoughts and feelings and feedback, and really just provide that casual environment for folks to share questions with us. So we were able to kick off this initiative in January. We had a very successful and engaging first session. So our second session will be on February 20th at 3 o'clock Eastern time. And we are able to, if we can drop a link in the chat, I will do that as well. And so we think that'll be another great opportunity that if you've got questions that come up in the meantime, please feel free to attend that as well and get your questions answered. And the second one is MDA on the Hill. Now, this isn't until November 2nd through the 4th in 2025, but we do want to just kind of give you a heads up that it's coming, and it's going to be coming quicker than I think anybody realizes how time quickly passes. So we're bringing several of the priorities that we talked about just now directly to Congress as part of that. And we're excited that we'll be able to grow the event this year. We have many experienced advocates who are on the call who have attended, and some new. And so we're hoping that we'll get a great mix of new faces and returning veterans to MDA on the Hill. So we're planning as we speak. Planning is going to really kick off in earnest in spring. So keep an eye on your inboxes for that first kind of information blast that we'll be sharing here in the springtime months, and we'll be asking you for your interest level in attending MDA on the Hill. So 3 days of networking with policymakers and your fellow advocates. So we're back on Capitol Hill at the same hotel we were at last year for hopefully what is typically a lovely fall in DC. So we hope that all of the folks listening tonight will be expressing their interest in attending MDA on the Hill. So just wanted to flag that for everyone. And I will turn it back over to Mark.
Great. So you might be thinking again, what can I do now? There's so many things you can do to make your voices heard. I went over a bunch of those in the previous slide, but if you just want 3 things to do, here are the first 3 things you can do to get started. First, again, is please sign up with us. You can go to mda.org/advocacy to do that. Many of you might have got this invitation through social media, a third party. So if you haven't signed up with us, please do. Again, you can also text MDA USA to 50457. Follow us on Twitter or X. I still call it Twitter. I don't know when I'll ever start calling it X. But you can follow us on that platform at MDA_advocacy. That's the best way to know what's going on in advocacy. And then then if you really want to take action with us, we really are kicking off our Medicaid campaign. So I've seen lots of things in the chat about what is MDA doing to protect Medicaid. It is our huge focus, especially on the grassroots side for the next few months and into spring. Very, very shortly, we're going to be launching a pretty sizable campaign to protect Medicaid. We'll give folks opportunity to share your story with us, to why Medicaid might be important to you or to people that you love. We'll give you the opportunity to write your members of Congress. We'll give you information about the program, social things to share, a really robust program around protecting Medicaid. You can see a little bit of a preview of the imagery on the screen right now. So our big push for this spring is to protect Medicaid. But if you want to get started now, which we always encourage people to do, you can contact your member of Congress as we speak, encourage them to protect Medicaid, and I put a link to that in the chat that folks can do. It might not have hyperlinked. I'll do that one more time. You can right now write your member of Congress and encourage them to please protect Medicaid as they work through the budgeting process. We'll have a lot more on this. Again, ways for advocates to share their story with us. We will hopefully be able to have folks film themselves and share why Medicaid is important to them that we'll share with members of Congress as well. So a very robust campaign that we're going to be launching very, very soon. But if you want to get started right now, you can click that link and contact your member of Congress. But way more on this to come, as it is our big priority for this year, is to protect this valuable, valuable program. So with that, I think we're in the Q&A, and we have quite a few questions in the hopper ready to go. So Paul, I'll turn it to you to start that.
All right, thanks very much, Mark. So obviously we went through a lot of content in about 56 minutes. So we're going to spend at least the next 4, but we'll probably go a few minutes thereafter to answer your questions in the Q&A and in the chat. And if anything else is coming to mind, please do put it into the Q&A or the chat box for us to answer. So I'm going to start over in the Q&A with a question from Samuka, and this is of course very relevant to what Joel has mentioned, what Shannon has mentioned, and what Mark has most recently mentioned, and this is about Medicaid. What is Medicaid, what is MDA hearing from lawmakers about proposed Medicaid cuts? What is MDA's strategy to defend Medicaid and other healthcare programs like the ACA? And what opportunities will advocates have to share their stories about the importance of these healthcare programs? So Joel, I think I'm going to hand it to you first to answer the first part of that question. What are we hearing right now about proposed Medicaid cuts? And what is our strategy to defend Medicaid and other programs that might also be potentially targeted?
Right. So in terms of what we're hearing, technically speaking, everything is on the table. Everything from instituting work requirements to block granting Medicaid to per capita caps on Medicaid. Those are things that essentially would create a more uniform split across what states get from the federal government for their Medicaid programs. But really what we've been hearing is rising to the top are work requirements on Medicaid. We're already going around the hill, both as MDA, but also with our coalition partners at the CCD. I can never get the actual full name out, and the Partnership to Protect Coverage. They're all holding group meetings as well to educate lawmakers on why Medicaid is so important and why programs like these would be truly harmful to those living with disabilities and the programs generally. From there, of course, we'll also launch the campaign, which will be massively important to getting people in front of their members of Congress. And we'll, of course, continue our own lobbying efforts as well.
Yeah, thank you, Joel. And strategy-wise, Samuka, I mean, back in 2017, we and many other organizations were able to successfully prevent Congress from making major cuts to Medicaid and the Affordable Care Act then. And we were able to do so by getting a ton of folks in our community and many other communities involved. So we're going to be expecting to be doing similar activities to ensure those in Congress hear the voice of those with neuromuscular diseases very loudly and clearly on the importance of Medicaid. And Mark, I don't know if there's anything further you'd want to add to Joel's comment about the ways in which we're going to be getting advocates involved.
It's a whole surround sound approach. So generating stories, getting letters to Congress, getting things done on social media, a surround sound approach of getting the word out of why this is so important to protect. So we have a lot more to share in the upcoming days. And Samuka, I will email you personally very shortly with everything we have. But it's all out to practice the campaign. The Paul and his team have been already having meetings about it. We've been having taking action already, and we'll continue to do that, especially with advocates. So it's all out to protect it.
Awesome. Thanks, Mark. Also within the chat box, we have a question from Barry about what are we doing to help people. Well, I'll just read it specifically. What help are you going to give for Medicare people with neuromuscular diseases? So what are we doing within the Medicare space? Joe, I have an idea or two, but do you want to try to take a crack at Barry's question?
Sure. So on Medicare, of course, we'll continue to work and make sure that the changes to Part D made under the Inflation Reduction Act are implemented effectively and as quickly as possible. Also, the bill that I mentioned, Access to Genetic Counselor Services, specifically impacts Medicare, as well as the various ALS-related provisions of bills that we've talked about as well.
And I'll mention, Barry, that we are very heavily focused on Medicaid, and we're heavily focused on Medicaid for a reason, because it appears as if that's what those in Congress might use to pay for the the budget reconciliation program, we're not necessarily hearing the same thing about Medicare. Medicare obviously is incredibly important for those with neuromuscular diseases, but might not be under the same threat that Medicaid is under right now. But to Joel's point, there's a number of different areas in which we're monitoring all parts of Medicare, trying to ensure that it's serving those with neuromuscular diseases as best as it can. All right, I know we're a minute past the hour, but we still have several questions to get to. For those of you who want to stick around with us, stick around for just a few more minutes. We got more questions. And I'm going to actually go up to the chat to answer some questions that we've gotten from Liz, and actually some of these pertain to the end of year package that did not end up passing. These are the leftover bills from 2024. So Liz asks one question about the timing, about why March is the month that we have circled. The reason for that is because March is the next time there is a must-pass piece of legislation that otherwise, well, we'll see if it's going to pass Congress. It's government funding, which expires on March 14th. And so we would expect and hope that Congress funds the government sometime soon before March 14th so that we don't have a government shutdown. Pretty much everyone is assuming that that's really only the next time in which bipartisan legislation, especially of major importance, will be able to pass Congress. And so that's why we're spending January and now into February trying to ensure that with attached to that funding package will be the whole suite of legislation that Joel described earlier, and that a lot of other folks are hoping will be able to pass into law. That includes the priority review voucher reauthorization. And the reason for why it has not been introduced, or perhaps the reason for why it has not been reintroduced, is because a lot of folks on Capitol Hill see the package of legislation that was negotiated and almost passed at the end of year as essentially a pre-negotiated package that is already ready to go again, that it might actually not need to be reintroduced again. It doesn't need to be a standalone bill again. It may actually just need to be essentially a negotiated pre-passed package that all it needs to happen is to be added to something else that's moving through Congress. It's a little frustrating how that could work. Why can't it just pass by itself? Well, that's the dynamics of our U.S. Congress. But nonetheless, because of how far it got last year, some may not be necessarily seeing and needing to go through the same process of reintroduction and committee hearings and things of that nature again. Now, that might not be a uniform opinion on Capitol Hill, but we know that some people in some important places hold that opinion. So that's why we might actually not see the priority review voucher reauthorization reintroduced. Joel, we're having a question from Crystal here about the Access Genetic Counseling Services Act. And Crystal asks, does this legislation include genetic testing and services for adults?
So yes, it does. Genetic counseling services primarily impacts Medicare, which is, again, primarily adults. To get at children, what we're looking at is the Precision Medicine for Kids Today Act, which is a separate bill that tackles that in its own way. But genetic counseling services is targeted more so at adults.
Great. Thank you, Joel. There's another question in the chat about the FDA user fee reauthorizations. Liz, I believe you're mentioning FDARA. That's the Food and Drug Administration Reauthorization Act. That was the last time that the user fees were reauthorized in the fall of 2022. And you're correct in that that is what is due to be reauthorized again in the fall of 2027. And that includes the prescription drug user fee authorization, the biosimilars user fee reauthorization, the medical device user fee reauthorization, and many of the other UFAs as they are known. So that is spot on. You got that. You got that right. So it looks like that might be all the questions that we have in the chat. I'm going to head back down to the Q&A as I think there's been some activity there. Autumn was asking about ways in which we're trying to raise awareness. And Shannon, you hit the nail on the head. You're talking about this in the right year, Autumn, because this is exactly what the 75th anniversary campaign is seeking to do. And we launched it last week, I believe, or yeah, it was last week that we launched it with some PSAs and videos and other ways in which we and just about everybody are going to be trying to spread the word about MDA and our mission and our community. And Autumn would encourage you certainly to be spreading the word with us for all those folks in your circles who might not know us. Our 75th anniversary campaign is an excellent time and place to reintroduce them to MDA, because we're not only going to be talking to them about what we're doing right now in this very moment, but of the 75 years of our history for that matter, in a quick and pithy way, so that they can get a good understanding of what we're doing at MDA. But this being said, and Mark, thanks for putting the campaign in the chat. You can follow the link there on to the campaign resources. If there are other ways in which you believe we can be better reaching out to those who don't already know us, we're always looking to do that, and that's where you can shoot us some ideas at advocacy@mdausa.org. If it's not for policy and advocacy to tackle, it might be for other departments, but we'll be sure that they get those ideas, and we're always open to new ideas. So with that, I think I may have come to the end of questions. I'm looking at my team. Are there any questions that anyone else has picked up on that perhaps I've missed? I think everyone's looking, but I don't think anyone's found anything as of yet. All right, I think we might be good. Well, look at that. We're only 6 minutes past the hour. I thought we might have gone even longer. 6 minutes isn't too bad. Thank you, everybody, for joining us this evening. Obviously, 2025 is going to be a big year ahead of us. We have a lot we're going to be tackling. We're going to have a lot we need you all to tackle with us. So please join us in our campaigns. Please join us in everything we're going to be doing together. And with that, I wish everybody a very happy rest of their Wednesday. Thanks all.